Okay, great. Thank you so much, everyone. Good morning, good afternoon, and maybe good evening somewhere, everyone. Welcome to the GFAN AP Update webinar number 3. My name is Jennifer Ho, and I'll be your moderator for today. We're delighted to have you here as we come together to share about the Global Fund's 8th replenishment investment case and provide you some key updates from GFAN AP, including our activities over the past 5 months and the upcoming plans in the coming month leading up to the Global Fund replenishment. Before we begin, I'd like to extend our sincere gratitude to all of you for being here with us today, and also special thanks to our esteemed speakers today for sharing their insights with us during this critical moment in the global health financing environment. A few housekeeping logistic issues to go over quickly. The webinar is being recorded, and a summary of our discussion will be shared as a blog post on the GFAN AP website later. We do kindly also ask our speakers to speak slowly and clearly to ensure everyone can follow along. Feel free to use the chat box to introduce yourself, including your name, organization, and country. If you have any questions during the webinar, please type them in the chat. And to minimize background noise, we do ask that you to please remain muted unless speaking. And with that, I'd like to hand it over to Blessy Kumar, our chair of the GFAN AP and CEO of Global Coalition of TB Advocates, to formally welcome everyone. Blessy, over to you.
Thank you so much, Jen. So it's my honor on behalf of the GFAN AP, which is the Global Fund Advocates Network in Asia Pacific, which is an advocacy platform for HIV, TB, and malaria communities and civil society organizations in the region. I'd like to extend a very warm welcome to everyone who's joined to this GFAN AP Update webinar number 3. And we're really delighted that you could join us. And I hope that the webinar will be informative and interesting for all as we discuss the Global Fund investment case and also see how we as communities and civil societies have a role and what role we can play in this time. Also would like to note that these are challenging times for all of us, and we acknowledge this. And at a time like this, I'd really like to say we need to stand together and support each other and really push for a fully funded global fund more now than ever, because these are moments that will really define us. So here's to looking forward to a great 1 hour of this webinar. Thank you so much for being here with us.
Thank you so much, Blessy, and thank you for that really great context setting for us, the reason why we're here. And on that note, I'd like to invite our speaker today, Johannes Hunger, Chief Advisor and Head of Special Project from the Global Fund, here to help us unpack the investment case of the Global Fund 8 replenishment. Johannes, over to you, and thank you again for being here to help us understand the investment case more. Thank you.
Thanks so much, and I hope you can hear me well. And thank you for giving us the opportunity to talk to you today about the investment case. And I have a few slides which I'll try and put up if you allow me, and I hope this works. Are people seeing a slide here already? Yeah? Okay. So just to say that the actual work around the investment case happened over the course of last year, and it hasn't been done by the Global Fund Secretariat as such, but it has been done under the umbrella of what we have established as the modeling guidance group for the Global Fund, which really includes our technical partners, which are absolutely critical in there, and all of the experts, modeling institutions that you see on this slide. This modeling guidance group is chaired by Professor Tim Hallett and Professor Nick Menzies as chair and vice chair. And it's really under the umbrella of this group that we do this work, because we aim for producing something that is technically robust, credible, and in line with our technical partners put out. The first step in actually producing the technical analysis of the investment case relies in determining what are the overall resource needs that we see across the three diseases and over the period of the next replenishment, which is 27 to 29, and in the countries that the Global Fund supports. That's always the first step, and we're looking at what partners have put out as their global plans to determine what that resource need is. We did it this time again. You see the current latest global plans that are available from our partners for HIV, TB, and malaria. And this added up to a number of $146.6 billion over the 3 years of the next replenishment. For those who remember, in the last replenishment, this number was around 130 billion. So we're talking about roughly 10 billion more now. In the next replenishment, that is simply the resource need that our partners determine is required to get to the global plan targets. As a next step, we then estimate what is available in terms of resources against those resource needs. And the first element that we look at are the domestic resources. We have this time contracted Stephen Resch from Harvard to devise a new methodology or have a fresh look at how we could estimate the amount of available domestic resources over 27 to 29 in the countries that we support. And Stephen has looked at what we have done in the past. We have this time a methodology that actually takes as a baseline what countries have reported as latest expenditures in their domestic programs in the three diseases, and we projected forward looking at the IMF projected economic growth in order to get to the estimate for the next replenishment period. This adds up to 69.7 billion across the three diseases. And you'll see a breakdown of that number in the actual investment case in terms of diseases, but also in terms of the different geographical areas. So this is by far the biggest part of resources that we project to be available in the next replenishment period. The next component is to look at non-global fund external financing. And here we have stuck to our previous methodology that looked at the last 3-year reported amounts of external financing coming from the IHME database, and assuming that that amount is flatlining over the course of the next years into the replenishment. Obviously, that is an assumption that now has come into question. We can talk about that in our discussion, but the overall amount here coming from that analysis and that assumption is $23.6 billion. And on top of that, we then have the global fund contribution. As you know, the overall ask is 18 billion, and that gets us to an overall amount of available resources that covers about 79% of that resource need that we have determined. So we're not covering 100%, but 79%. Now, why do we think that that is sufficient? And why do we think that that is, in a sense, the minimum that we need in order to achieve the impact that we have set out to achieve? That is where the whole modeling exercise comes in, which kind of translates the amount of available resources that we project on this slide into actual impact against the three diseases in terms of mortality and incidence reduction. Let me show you what we have projected based on the methodologies that we have applied. So this here is the combined mortality rate across the three diseases, and the black line here is what we have achieved so far. Now, this doesn't look so fantastic. It's just the line that starts in 2015. If you had this line starting in 2000, you would see that there is a significant reduction in mortality rate that we have already achieved. More than 60% of reduction in the mortality rate and more than 65 million lives saved, as you know from our last results report. So there is already significant impact that we have demonstrated, that we have achieved in the three diseases in the past. However, if you're looking at this yellow line, and please interrupt me if you don't see what I'm talking to. I see it on my screen, but I hope you see it too. This yellow line is the global plan trajectory that we would have to be on if we were to successfully achieve the SDG targets related to the three diseases by 2030. So you see there's a gap. We are already, as it is now, off track with respect to where we would have to be. That is a starting point. I think that's not a surprise to anybody. We have made that point very clear also in our results report, and you see it in our partners' publications as well. So the question is, how far can we get with the monies that we anticipate to be available between now and the end of 2029, the end of the next replenishment? The first scenario, well, sorry, here's another reference point you should be aware of. This is what the Global Fund has set for itself as strategy targets in terms of mortality reduction for our current strategy, which ends in 2028. So obviously that's another reference point in terms of where we would need to be. There's a low, a medium, and a high point. Those are explicitly approved targets that are part of our Global Fund strategy, approved by our board. Now, a scenario that would assume no scale up from where we currently are in terms of coverage percentages that we have achieved so far in the three diseases would look like that. So you would have no further reduction. You would actually have a certain increase in the mortality. So that is a scenario that we obviously want to avoid. We need scale up. That means also we need to have more resources. And looking at what a successful 18 billion replenishment would signify, you see the turquoise line here with the uncertainties around. That is the outcome of the modeling of what can be achieved if the resources that I showed in the previous slide were available, if we had a successful 18 billion contribution of the Global Fund. And you can see that we would bend the curve of the combined mortality even further. We would actually reduce mortality by another 60%. We would hit our strategy targets, as you see, in the medium range for sure, and we would get relatively close to the actual level required by the global plans required in order to achieve the SDGs. So therefore, the logic of the global fund investment case was that we need that 18 billion if we want to stay within reach of the overall SDGs, but also if we want to be sure that we can hit our strategy targets that the Global Fund Board has set for the Global Fund. Now, if you're looking at what this means in terms of lives saved, there would be 23 million lives saved based on the reduction that you see here over the 27 to 29 period. A similar slide for the combined incidence rate. You see that again, we would hit our strategy targets by 28. There is a bigger gap with respect to what's required by the global plan here. So clearly, therefore, we can't pretend that with 18 billion, we're right bang on the level of the SDG required level of incidence. We have a gap, and it's a little bit differentiated disease by disease, but more than 400 million infections would be averted, and more than 50% of a reduction in the incidence rate would be seen with a successful replenishment. Those are obviously quite significant and impressive results that are needed if we want to stay true to the overall ambition that we have collectively signed up to. Now, I can talk a little bit into the picture disease by disease. I'll not go into too much depth given the time we have, because I want to talk about the other analysis that we have done as well. But when you look at the HIV situation here, we really can show that with the assumptions that we have made, with a successful replenishment, we really have the overall global plan target within reach. We can actually grasp it if we successfully raising the monies that we need. You see here, the successful replenishment dot is at the level, is even slightly higher than the level of incidence and mortality reduction that the HIV/AIDS global plan requires. For TB, the picture is not quite as significant, but you can see that we would be able to sustain the momentum that we have achieved in the TB response. And you can also see that we would have a possibility to get within reach of the targets that are set by the NTB strategy, not for 2030, but for 2035, with respect to mortality and incidence reduction. This is obviously, again, a significant improvement. Here you would see that TB death would be reduced by more than 55% and the TB cases by 26% between 2023 and 2029. For malaria, likewise, and we know that malaria is a disease that is really at risk of showing the rebounds that we want to avoid. You see here the no scale-up scenario. If we just maintain current coverage, you see that there are significant rebounds that we would expect, but a successful replenishment again would imply that we could reduce malaria cases and malaria deaths by 57% and 65% respectively between 2023 and 29. So significant progress towards the level required by the global technical strategy, the global plan of malaria. Now, we have also done additional analysis on what these achievements would mean in terms of economic returns, in terms of returns on the broader health system and the economy. The first is that we have determined that there is a return on investment of 1 to 19. So every dollar invested sees a return of $19 in terms of intrinsic monetary health gains. We have another figure that looks at pure productivity gains, which is 1 to 3.5. It's lower, but it really looks narrowly on what the effect on productivity in each of the economies are. This would obviously mean that an 18 billion replenishment would result in more than 300 billion economic returns over the 3 years of the next replenishment. We have also looked at the effects on the reduction in inequality in life expectancy. We have shown already in previous investment cases and in the results report that the progress that we have made in the 3 diseases had significant effects on extending the life expectancy in the countries that we support, but it has also effects on actually reducing the inequality in life expectancy between poor and higher income countries. And what we see here is that global inequality could be reduced by a further 7% between 23 and 29. And we have done a new analysis that looks at the effect of reducing the burden on the health systems by making progress in reducing the burden in the 3 diseases. How much capacity do you actually free up? How much savings do you generate in terms of freed up hospital beds, in terms of outpatient visits that don't have to happen because you have managed to reduce the burden in the 3 diseases? This adds up. This is the first time we have done this analysis. This adds up to $42 billion of savings or costs that are averted in the primary health systems that we operate between 24 and 29. And you see the breakdown here by region. You'd probably be more interested in the East Asia Pacific and Asia regions. The lion's share lies within sub-Saharan Africa, but there are still very significant savings also in the other regions, as you can see from that diagram. Lastly, and not, of course, to forget, this is a very important role that the Global Fund plays. We would also strengthen health and community systems in the countries that we support. We estimate that out of that 18 billion, around 1/3, 6 billion, would contribute towards that space. We have, for the first time in the investment case, based on a case study from Malawi, been able to really quantify the impact of health systems investments. What this case study shows quite impressively, I think, is that if you, alongside the scale up of the services in the 3 diseases, invest in healthcare systems, in community health workers, in supply chain, you actually see a 35% greater reduction in the burden in the 3 diseases. So it has a direct effect, obviously, on the progress in the 3 diseases. That's why it's so important to really achieve our core mission. But you also see that there are other deaths beyond the 3 diseases that you can avert, and other lives beyond the 3 diseases that you save. So there's an additional impact. You see the numbers here on the left side in terms of the death, and the other deaths from other conditions are, as you see, quite significant. In the case study that we've looked at, now this is not a portfolio view, but I think it can be taken as a good indication for why these health systems investments are so important and are obviously part of the overall ask that we're putting out and the role that the Global Fund plays. And lastly, and that's the last slide I think I have, we have also looked at, in this context, what is the contribution of the Global Fund to achieving universal health coverage. You know that the Global Fund takes the U in the universal health coverage concept very serious. We are really there to look at how can we get equitable access of the population in the countries that we support to the services. But we've also looked at the metrics, and there is, as you know, a UHC service coverage index that is used to track progress towards the UHC goal. This index has increased in the past to like 58% over the past 2 decades. But we have been able to show that more than 2/3 of this improvement is due to the progress made in the 3 diseases. So the Global Fund partnership and its work are a key driver historically already to achieving UHC, not to deny that there are still, of course, gaps, but those gaps are stemming from other areas. So the Global Fund and the work in the 3 diseases has been a key element of getting us to where we are today. But we have also looked at going forward, what a Global Fund AIDS replenishment with the ask that we have put out and being successful in that would mean. And it means that we would basically be able to further increase that score from 58% to 67% by 2029. That's assuming that all the other key services that are under this coverage wouldn't move, so hopefully would be higher. But you can see again that there is a significant contribution from the work that the Global Fund and its partnership is doing towards getting to the UHC overall target that the world has set for itself. So I stop here. I think I've covered a lot, probably a lot of questions, and I'm happy and looking forward to the discussion. Back to you. Thank you.
Thank you so much, Johannes, for that really comprehensive and for me, it's very easy to understand presentation. I don't know, it's because I've seen it a few times, but I feel like every time I've learned something new. And I think the point about the contribution to the UHC progress, I think this is the first time it's really hitting me. So thank you for that. So let me open the floor up to the participants online for any clarifications, reactions, comments to the investment case. And again, I think there are some really important figure in the presentation that I think we all should be taking note of and will be really critical for our advocacy work and mobilization in Asia Pacific for the replenishment coming up. So let me open the floor. Can anybody would like to make a comment? Raise your hand. Hi, Sola. I see your hand up. Let me invite you first to introduce yourself, and then please be succinct in your comments, questions. So thank you.
Thank you. Thank you, Jennifer. So thank you very much. I agree. I think the investment case gives a lot of insights on what we can use as advocacy ask within the country, within the region, globally. I was just curious, do we have any figures on how much of Global Fund investment has been in terms of supporting communities for implementation or things like that? I know there are elements of human rights, but it's too broad. So if you have any details on that, that would be very useful. Thank you.
Should I respond right away, or are we collecting a few questions?
Let's respond right away, if that's okay, Johannes. Yeah.
There is certainly there are figures in terms of how much the Global Fund has invested in community health workers, for instance, in community systems. I do think the investment case, and that is something I haven't said, under the RSSH chapter really lays out some of the expectations of where we would invest in the future and what kind of what we could achieve with respect to the new KPI metrics that we have set. Historically, I know that there is a breakdown also in terms of where money has gone that includes the amount of money going to the community health workers. I think that's probably more in the results report you find it. I can look into it and get you a figure. That is certainly what has been spent so far or is currently budgeted. The investment case forward-looking part, we have stayed away from trying to say how that 6 billion that we estimate to be in RSSH would be spent and how much, for instance, of that would be in community system strengthening versus other areas. I think that is because, as you know, we we are obviously still very much based on the principle of country ownership and rely on what countries put forward. So we can't predict what exactly the breakdown would be, but happy to look into the historical figure. I'm pretty confident there is one, if that's helpful to you, or you can note that as a follow-up to this discussion.
Great, thank you. And I see Rachel also has an additional comment in the chat. Johannes, can you elaborate a little on the difference between the ROI figures from the last replenishment and this one? Is it because of the different methodology?
Yeah. That is something that I maybe should have noted. I think the last one was 1:38 or something. It was much higher, but it had to do with the specific counterfactual we had used at the time, which was the counterfactual of continued COVID disruption. You remember that the last investment case was released and developed just in the middle of COVID, so we used that. It is an extreme counterfactual, more extreme than what we have used this time, being the constant coverage scenario. So therefore, the last replenishment is an outlier. If you go back to the sixth replenishment, the Lyon replenishment, you will see that the ROI there was in line. I think it was 1:18. So it's really important to note that the seventh replenishment, due to the COVID situation and the extreme counterfactual, had an outlier in the ROI figure, which was higher.
Right, thank you so much. Just in case people are wondering what our ROI is, return on investment. So the one
Return on
to
investment, exactly. Yeah. Absolutely.
That's okay, thank you. Anyone else? Any other additional comments or clarification, reactions to the presentation? Johannes, and would it be okay for us to share the presentation as well?
Yeah, absolutely. Let me just, I think I had in the back end of the presentation a lot of slides which I didn't use. We can send you a cleared up version of the slides I just presented, because I don't quite know what's in the back of what I shared with you there. I did it last night, but absolutely happy to. And yeah.
Thank you so much. Any other questions or comments from the group? Otherwise, I'll take it as a sign that the presentation was so clear. We're all very clear, and then we have now. Okay, Pauline, you're from the Secretariat.
Come on, Pauline. Don't ask me difficult questions.
No. I just wanted to add a few comments, not on the investment case, because we have here like the experts, but just also in terms of framing this, vis-a-vis. But I see there's another question now from somebody else. The previous presentation that Françoise had done, I mean, for the launch of the campaign, but also in other like GFAN call. So now the investment case is launched, and was launched at at an event that was co-hosted by South Africa, and in which we were able to announce the two co-hosts, South Africa and the UK. We're now working with the two co-hosts in developing, the next step, and where we will be holding the pledging meeting. I know many of you have some question about that, but this is still under discussion. We have a working group around that, and now that we have the investment case launch, we can start also like the donor tours in capitals. And some of you who follow advocacy partners in donor country will have seen that the last 2 days we had Peter Sands and Françoise Vanny in Brussels. You had a number of advocacy events organized by our partners, Friends Europe and its funds. And we're now really presenting the investment case to the donors and being able to discuss with them the numbers, the figure, and we'll continue in the different donor capitals. And that will be as part also of the different campaigns. But didn't know there were still some questions. Over.
Great, thank you so much, Pauline, for that additional framing. Let me take 2 more quick comments. One is from Abdul, online with us. You have your hands raised. Abdul, would you like to join? Thank you.
Yeah, good morning to you all. I'm Abdul speaking from Ghana.
Go ahead.
Yeah, my question is, how do we use communities who are directly affected or benefiting from global funds to ensure that global fund investments are being used for the right purpose or are directly being used to affect communities in crisis? And what is global fund role in recent funding crisis that are surrounding us now? How do we
Okay.
ensure that funds are being channeled to those places? Or is there a way that we could have a consolidated wealth fund that will affect all countries? I don't know.
Okay, great. Thank you. I think we understand your question. Before I invite Johannes or Pauline to respond to that, I think that goes well with the second question from Rachel in the chat. Given that the investment case was finalized before funding was withdrawn from particular donors, we also understand that this was also based on getting to the KPIs of the Global Fund. Are there considerations in the Secretariat on this, and how can we support even more, noting that the investment case is to support the ask of the Global Fund? And I think linking to Abdul's question, it's, to support community strengthening as well. So Johannes, over to you.
Yeah, no, good question. And I mean, that is yeah, obviously a bit of the elephant in the room. As you say, the investment case was developed before all this set on. Let me try and take the questions in different parts. I mean, one is a question, what are we doing now? And obviously, I think no deny this what we're seeing is a shock to the system. There are like disruptions in providing services, life-saving services, and the Global Fund is, I think, doing what we can to see how we can, work with all the partners on the ground to unblock where there are blockages, to see how we would have to, potentially reprioritize funding that we have in order to address the highest needs. I think it's clear that we're not being able to fill any gaps at this point. We're not having more money. We're under pressure, as you know, as well. So the question is, how can we use the monies that we have in the best possible way to address some of those disruptions that we are seeing? So I think there's a clear effect that I think we would expect to see in the current cycle, a little bit like the shock that COVID had provided to the system. It's too early to say how big that is. We have partners, of course, producing estimates in terms of the number of additional deaths that could occur in the coming years if those cuts were continued. And we're looking at it ourselves. Now, what we can say in the context of the investment case, I mean, two things. One is these are projections for 27 to 29. As I said, it's, I think, too early to say we need to completely revise it. We do recognize that there are risks to the assumptions that we have made. In particular, of course, and I noted it very briefly because I expected there would be a discussion here, and it's good to have it now. In particular, on the amount of non-global fund external financing that we have estimated. I said this is adding up to $23.6 billion over the 3 years, based on what has been reported in the last 3 years. I think 21 to 23 is the period that we have data on. And of course, in that 23 to 0.6, there is more than half, actually 60% is funding coming from, that has come from the US. That is, of course, currently in question whether it continues. So there's 60% of that block that we cannot take for granted will be there. Now, do we know that it will not be there in 27 to 29? I think no, we don't know. We don't know how much. There is certainly a risk. But just to put it in perspective, and maybe I can go quickly to that slide since I'm still sharing. If the time allows, Jennifer, I'm in your hands. I'm just going to make the point on the basis of that one slide because it's important to understand that. This one here. So here you see the $23.6 billion. That's the non-global fund external financing. 60% of that second block, so more than half of that second block, is from the US. It's questionable, at least, whether it's there to the full extent in 27 to 29. But you also see that that is 60% of not the biggest block in terms of available resources that we project. The biggest comes from domestic resources. And if you look at it in terms of the total, it is actually more than 10 to 15% of the total funding that we project, which adds up to 111 billion. So that puts it a little bit in perspective. So we're currently looking into what this would mean in terms of our projection as potential downside risk. We're not going to revise the investment case in any way, but we acknowledge that this is something as an assumption that appears to be risky at the moment, given what's happening. But again, hard to predict what's going to happen in the 27 to 9 period. We have the transparency in terms of underlying assumptions and what the sources of these numbers are, and we're trying to assess also what the kind of downside risk would be. In any case, and that's my last word, all this indicates to the fact that the 18 billion from the Global Fund really need to now consider to be a bare minimum, really, if we want to get to the level of impact that I just presented in terms of what we projected. Over. Pauline, do you want to add?
Thank you so much, Johannes, and thank you also for that really frank and transparent response in addressing the elephant in the room. Before I wrap up this session, I also would like to invite Quentin from the Global Fund Advocates Network, GFAN Global. They are also doing, and they have been doing something around the investment case after the release. So maybe this will also help set the context and provide some additional insight onto this issue. Quentin, over to you.
Hi, Jennifer. Hi, everyone. Thank you. Yes, I'll be very short, but GFAN Global, not GFAN AP, has released. It's always, I apologize, it's always a bit confusing. We have released an analysis of investment case, which I think does. I don't know if I wrote half of it, so I think it does a great job at replacing the investment case into that overall context of the cuts in American funding, because as Johannes made very clear, the investment case was developed before we knew that this was going to come, and so we tried to reflect on one, what did we want to see in this investment case. There are things we regret, in particular the fact that there's still the projections that are made in the investment case still account for a funding gap, which we think does give room to donor countries to justify ongoing funding gaps, which we don't think is something that should be in there. But overall, we find the target ambitious. We welcome that the target wasn't suddenly slashed because 18 billion now feels extremely ambitious, considering the situation in a number of donor countries, and our understanding of the situation in that regard. And we also really welcome within the document itself the fact that there was there seemed to be no attempts at pulling punches in terms of talking about climate change, talking about the importance of key populations, talking about the importance of human rights, etc., which we know other organizations have been doing, and we welcome that the Global Fund hasn't given up on its values despite the difficult context. So that a bit more is in the link that I've posted in the chat. I will add I will add one thing, which is that there are two fights that we need to lead as advocates when it comes to resource mobilization. There's a replenishment fight for the aid replenishment. There is also a pledge conversion fight. We heard some relatively positive news out of the US, which seemed to have budgeted in the last document we've seen for the full contribution to the Global Fund next year out of a pledge for the 7th replenishment. But we know that in a number of countries, especially in Europe, and that includes the US, it is unclear whether even the money that was pledged in 2022 is going to hit the bank accounts. We're worried about France, we're worried about Sweden, we're worried about the Netherlands. So just putting it out there, but there really needs to be that when it comes to donor countries, especially large donor countries, there needs to be a look at the two sides of a question. One is additional resource mobilization and forcing people to keep their words. That's my last bit.
Thank you so much, Gundan, for that additional, and I think we'll continue to have this conversation in the second part of our webinar as we talked about what we should be doing collectively and some of the key activities for the coming months on replenishment. I'd like to invite Ken Koo, who is a communication officer from GFAN AP, to help share a little bit more about the replenishment campaign that GFAN AP has developed more now than ever. And this will build on what Johannes has presented as well to give us some action points. So Ken, over to you.
Thank you, Jen. Hi, everyone. I will keep this very short and sweet because I'm sure many of you by now be very familiar with our campaign. So this is GFAN AP's 8th replenishment campaign in support of the Global Fund replenishment in moments that define us more now than ever. So very quickly, you would have remembered for the 6th replenishment, we had a bunch of campaigns: Love More, Give More, Heroes Give More, and the Thank You campaign. And for the 7th replenishment, we had In Extraordinary Times, The Power of More. And I won't go through the video here, but this is on our YouTube, and you're very welcome to watch that at your own time. But we realized and we recognized that leading up to this replenishment, this would very possibly be the most difficult one yet. And we sat down with many of our partners to discuss and really nail down what it is that we wanted to convey. And what we arrived at is we realized that we wanted to highlight both the urgency and the importance of this moment while being very clear in the way that we message. And so we've developed a bunch of messaging angles while also keeping in mind the considerations that right now we are seeing major cuts in the funding and development landscape. And this is something that we want to talk about very realistically. And while we want to call for more, we are also aware of the fatigue around the messaging of more money, more money, more money. And therefore, we are expanding the idea of more to include more commitment as well as more action and more accountability. So I won't talk too much, and I will play for you our campaign video, which will explain a little bit more about the different sub-themes as well as messaging angles in this campaign. All right, so the video you have just watched is now on GFAN AP's YouTube channel, and we have included translations in 8 different languages, and we have 1 more pending. So you please feel free to share that widely. And you can turn on captions to have all the translations visible, so that it is broadly accessible as well across communities. And for our communication strategies, in addition to this video that you have just watched, we are also we are in the midst of finalizing and about to upload a social media toolkit. So keep your eye on our social media accounts. It will be coming out very, very soon. And we please ask that you reshare that and blast it in your networks as well. And we will also be producing physical collaterals at the right suitable times and events. I also just wanted to very quickly share before I pass it back that for this replenishment, you may remember the activity of folding paper cranes as part of our 7th replenishment. This time we will be folding paper stars, and this will be something that we'll be doing as a community, and hoping to get everyone's action in. And you can write messages in the stars, and this will be a theme that will be coming up over and over again in our physical events. We're also preparing targeted statements and letters. So we will have a World TB Day statement coming out very soon on Monday. And we also have the thank you letters, which is in the midst of finalizing and waiting for the right time to be released. And we are also looking at doing embassy events. So this is just a snapshot of what the campaign has in store. I will pass it back to Jen now.
Thank you so much, Ken. And thank you for Ken helped lead the work on development of the campaign and visuals. So we're all very happy with that, and hopefully this will inspire groups to join our campaign as well. And on that note, I'd like to then invite Rachel as a follow-up to what we will be doing for the replenishment coming up, and also share a little bit about what we've done over the last 5 months. So over to you, Rachel.
Thank you so much, Jen. Thank you so much, Ken. I can't express my appreciation to both of you, but also all of you that are supporting GFAN AP in the work that we're doing collectively together. Ken, can you put up the slides, please? Thank you. So this, I'm going to make it very brief because I want to spend a bit more time speaking about what we will be doing rather than what we've done. But this is a very quick snapshot of things that we've been involved in, key events and key activities since October, which was our last update call. We've released 2 public statements. We've attended several face-to-face meetings and events. To learn more about what the plans were for the Global Fund replenishment and to advocate for more resources going to the Global Fund, obviously. There have been a number of webinars where many of you have also been part of, namely around the Global Fund results report, on mental health series number 3. And then we had in January onwards very difficult calls around the donor withdrawal in January and in February. From there, we would be actually producing, which will be the next steps. Next slide, please, Ken. 2 slides on. Yeah, so this is a calendar of events. You can ignore the text, the very small text on top, but this gives you an overview of some of the work that we'll be doing in the coming months. That would involve having a webinar that we're aiming to have in the first week of April around innovative financing that can support our colleagues at the country level around DRM. This phrase has been flagged around for at least the last 7-8 years, I believe, at the Global Fund Secretariat. But we wanted to be able to unpack that a little bit more, especially in this current environment, to see how some of these tools might be useful for you at country level to be able to advocate for and to work on. We'll be doing some of the work around G20 and TCAD. We're also expecting to have a webinar in April around that, to share with you what our plans would be leading up to the G20 meeting that's going to be held later in the year, as well as the TCAT 9 that's hosted by the government of Japan with the ministers of the heads of states from African countries, hosted by Japan. But we are expecting to do some events, embassy events, namely in Indonesia and India. We're exploring others. There's one that's to be confirmed that's happening next month in Laos. We're working very closely with some of our partners that we have not engaged so much in the past, which includes the Global TB Caucus, as well as APALMA, which is the Asia Pacific Malaria Leaders Alliance, a leadership alliance. They're holding a invite-only summit on malaria in Bali in the 16th and 17th. But I think Shri was on the call or still is on the webinar, and I are working very closely with the APALMA Secretariat to make sure that we're inserting communities and civil society partners in every direction and every session as possible. We're also looking, and thanks to our colleague from Masaki from Africa Japan Forum, whom we're working very closely around TCAT. We're also going to be engaging in conversation. We started engaging with our partners at the 7 Alliance around the upcoming APEC, which is going to be held in Tokyo as well. There are a series of other International Day, health-related day statements that we're going to be releasing, but primarily as the More Than Now Than Ever campaign is around, we're going to be starting mobilization in terms of the embassy visits from April onwards. So we'll be keeping all of you very, very updated around when each donor would be expected, or which donor we would like to target during which particular months. This is very different from what we used to do in the past, which is we do 1 week where we visit all the donors, which many of you have really participated and engaged in, but have provided us feedback that that's really difficult at times as well, especially to secure the meetings with the donors at such during that week. So we've spaced that apart for this year and taking a much more targeted approach in terms of the support that we'll be providing also to country partners with a very specific language that we'll be also looking at speaking with donors when you have those embassy visits with them. So this is a quick overview. Ken, can you move back to the next slide? I do want to acknowledge some of the, give you an overview of some of the pictures from the meeting that we had with Africa Japan Forum and UNAIDS in Bangkok last month. Time's very blurry for me at this point, and I'm very, very happy and pleased to announce that we have signed our memorandum of understanding or ways of working document with our 7 Alliance partners in early end of February last month. So thank you to all of you for all the support and the work. And we're really looking forward to working a lot more closer and closely with all of you. Can I just hand this over back to Jen? I think we can take 1 or 2 questions.
Great, thank you, Rachel. Let's open the floor up for 1 or 2 questions or comments from the floor, or how you would like to offer your support to our campaign. We would love to hear that as well. Anyone? Okay, maybe I don't see any hand, but maybe people do need some time to.
I'm just assuming everyone's going to offer your support regardless.
Everyone's offering the support, they're just thinking through how they could best offer themselves, and we will hear all from them again very soon. But again, I think we'll be having all these materials and on our website, including the campaign video. And please do follow our social media on Facebook, LinkedIn, and I don't know what else we have, Blue Sky, just to follow our progress and the different activities that are coming up. And we'll definitely be keeping everybody posted, especially with making the stars. I think, yes, please get as many people involved as possible. On that note, before we wrap up the session, maybe Rachel, I'm supposed to hand over back to you for wrap up and closing, and then. Yeah,
I just want to really thank everyone that's been so supportive of the work around the Global Fund replenishment and on GFAN AP as well. We know that a lot of it is actually additional to what you're doing at the country level. So we really, really do appreciate that and your engagement and your support around the work of the Global Fund. This is going to be a really, really tough year. So we're going to be counting on many of you for additional support in this really tough environment. So, but please also do count on us to be able to offer you any support and in any way that you think is useful for you. I'm going to stop there and thank you for your time. I want to thank Ken again and Jen and Pauline and Johannes and all of you for being here with us over this last hour.
Yeah, and on that note, let me officially close our update session today. And please just stay tuned. We do have a few other webinars scheduled coming up, including a session on innovative financing as a key topic that we'll be focusing on in the coming months. So look out for more information from us, and we look forward to seeing everybody again at our next webinar. So thanks.